Film project on Myra Levine. It's a Charles Drew University of Medicine and Science. This is a paper for Advanced Nursing Theory by Professor Rosario. The group has members Ijoma Bagua, Oyinade Kamson, Tabitha Mason, Layla Malak, Asha Miller, Florence Mbanu, and Margaret Kayura.
Introduction. Levine's theory provides a cognitive approach that can facilitate the nursing jobs in developing and framing interventions that are widespread or comprehensive in nature for better and more effective curative, objective, and results. The conservation theory propounded by Myra Levine, born in Chicago in the late 1920s, was greatly inspired to choose nursing as her career due to her father's illness. Her model will be emphasized in 6 QSEN competencies: patient-centered care, evidence-based practice, teamwork and collaboration, safety, quality improvement, informatics. Thank you.
This theory with the principles of patient-centered care. Respect of patients' preferences, coordination and integration of care, information and education, physical comfort, emotional support, involvement of family and friends, continuity and transition, and access to care. This is in the Picker's 8 principles of patient-centered care. Patient-centered care has care management team. It has an integrated care continuum, a registered dietitian or nutritionist. It has a care coordination, wound specialist, nurse and clinical educators or coordinators, patient engagement, board certified nutrition support and pharmacists, and the nurses are in the center of all the patient-centered care.
Hey, good evening, Mr. Zimduru. Mr. Zimduru comes with a very great scientific background, as well as experience in public health and business administration. He has been on both sides of the fence as an administrator in a hospital setting, and also as a patient at an outpatient facility for regular checkup here and there. I will be discussing from the patient's perspective how he will view patient-centered care. I'm going to be using Myra Levine Theory. Mr. Duru, what will be your expectations from your provider on patient-centered care?
My expectations from my provider for patient-centered care would be centered around compassion, of course, in terms of the interpersonal relationship, but the ability to prevent and thoroughly diagnose, because it has been shown in a lot of studies that your primary care provider provides misdiagnoses for the primary diagnosis the first time around, and that can cause issues in terms of people returning and people patient retention and people actively seeking health as frequently as they should. So I think that would be the forefront, just having a primary care provider that is compassionate, attentive, but also extremely knowledgeable enough to the point where the patient doesn't have to come back 2, 3, 4 times to get the correct diagnosis. I know it's variable in terms of the degree of difficulty assigning the right diagnosis the first time, so it wouldn't be perfect, but I guess in my ideal situation, I would maximize both of those.
Okay, you've also mentioned during part of our interview that you had back pain and you had an x-ray done. Your primary physician was not able to get those results back to you timely, but when you went in to talk to another one of the providers, she was able to pull the information for you within a few minutes. How would you differentiate the two services between these two providers?
I think that providers should be in an atmosphere where they can adequately do their job. And it's hard for a provider to do their job when they have 50, 60, 70, 80 patients. And so, as a healthcare organization, I think it is irresponsible to overload your doctors, because with the more patients they get, which is the example I was getting from, I had two primary care physicians. One of them was orthopedic based for the back x-ray, and then the other one was based for my therapist. And the therapist actually left the health plan because the organization was assigning her too many patients, and it was too hard for her to adequately do the job that she loved doing. And so when you do stuff like that, that's what creates the issues, like it taking extra weeks for your x-ray to get back, your doctor being kind of short with you, not really knowing your name, maybe not for remembering what you said last time. Like, these are all unfortunate byproducts of upscaling. So it was an annoying experience from the patient side, but knowing how hospital administration works with this particular health plan that I have, I wasn't surprised. So I guess I hope this answers your question.
It did. With your physical therapist being able to access your x-ray report and was able to analyze it and provide care to you, how was that able to help you towards complying with your plan of care?
It provided me with a plan of care because it didn't necessarily provide me with a plan of care for my x-ray orthopedic related issue, unfortunately, because that just kind of resolved itself. But I do realize the difference between my therapist and my general primary care physician, and that difference being that even though my therapist has a lot of patients, my primary care physician has more. So it's harder for him, and it's harder for him to do follow-up appointments. It's harder for him to remember the notes. It's harder for him to diagnose things as quickly as they should be diagnosed, so that way I can immediately start a recovery. It's harder for him to do all that. It's easier for the therapist.
Okay.
So I guess, just the attentiveness makes the plan of care a lot easier on the patient.
And what will you see change towards with your primary care physician, so that you can see more one-on-one communication, physical comfort, information, and education towards your plan?
I think the only way that could change is if I get a new healthcare plan. Like I said, I don't really want to put names out there, but with the healthcare plan I have, I'm not surprised, because it's a very big scale healthcare plan. When you have lower healthcare plans, you get more, I wouldn't say specialized, that's the wrong word, but you get more one-on-one care just because it's a smaller scale. So that's it. It's a smaller, more direct patient to provider ratio, as opposed to my healthcare plan, where, for example, the patient to provider ratio would be like 1 to 50, one doctor for every 50 patients or something like that. I'm sure the ratio is a lot more complex than that, but just on average, a bigger healthcare plan usually means that kind of thing. The same way a bigger university means you'll have less time alone with your teachers, the same way, it translates. So I guess the only way to get it better would be to just have a healthcare plan where it wasn't as huge scale.
Makes sense.
Because the general practice is always, in almost every healthcare plan, the general practice is usually going to be the biggest pool, just because that's what everybody uses the most. So,
All right. Thank you so much, Mr. Dubero. From every indication, I can tell that you are seeing it from both sides of the fence. You understand the providers, how overwhelming they can be, and that actually affects their responsibility towards their patients. Mm-hmm. And also you see the administrative part of it, but as a patient point of view, mm-hmm. you expect service to be provided to patient, access to care, continuation of treatment, involvement of the family, friends, through the physician, so that the communication channel will be open. I see that from everything you told me. But thank you so much for your time tonight. I really appreciate you. This is
of the movie A Nursing Theory. The movie Still Magnolia depicts a group of women from different backgrounds and personalities who meet at the local hair salon to gossip. The movie focuses on friendship, acceptance of one another, and honesty, even during harsh times. The fundamental concept of Myra Levine's theory will be used to analyze Shelby. Myra states that when an individual is in a phase of conservation, they can adjust to health challenges with the smallest amount of effort. Patient-centered care here, basing on the Myra Levine Theory. Although all theorists focus on the outcome of nursing care, the goal of nursing accordingly to Myra Levine is that nursing involves engagement in human interactions. By proposing to address the conservation of energy, structure, and personal and social integrity, this nursing theory helps guide nurses in providing care that will help maintain and promote the health of the patient. Her theory is to promote wholeness while realizing that every individual requires a unique cluster of activities to achieve this wholeness. Wholeness is achieved when the patient is interactive with their environment. This allows integrity to be assured. Wholeness is therefore promoted by the use of the conservative principle. Levine views a patient's individual integrity as his or her own concern. It is the nurse's responsibility to assist or defend their patient to seek the realization of that individual integrity. Ways we as nurses could promote patients' individual integrity are by advocating for the patient, maintaining good communication skills with the patient, ensuring that patients are part of their care plan, etc. Patient-centered care. Conservation of energy refers to balancing energy input and output to avoid excessive fatigue. It includes adequate rest, nutrition, and exercise. One of Levine's major concepts of the conservation of energy is the environment. The perceptual environment is influenced by the information that is recorded by the sensory organs. Patients respond to sense organs well: sight, smell, feeling, and taste. They can feel their surroundings and will respond according to our approach towards them. Providing friendly, healing, and healthy environment for a patient improves patients' response to their care. This can be achieved by creating an environment centered around trust, compassion, and incorporation of our patients' personal values and cultures. Also, communicating with patients and family regarding the plan of care is crucial and helps with the patients adhering to treatment. According to Myra ETAL 2022, a patient actively participates in their treatment. Despite her struggles, she's determined to lead a normal life. Due to her pregnancy against medical advice, she loses her kidney function. This is the patient discussed according to Myra. In terms of health perception and health management, Shelby is quite knowledgeable about her disease. She sees specialists on a regular basis. Teamwork and collaboration. Based on the nursing theory, the nurse's role in conservation is to help people keep together their whole selves with as little effort as possible. She expresses that she enjoys working around babies. Shelby is a nurse from the movie, and her mother suggests that she should stop working to give her circulatory system a rest. Currently, Shelby works as a nurse in the nursery. As evidenced by her vocalization, Shelby is able to communicate her needs and wants. Evidence-based practice. Practices in the healthcare that are based on evidence are called evidence-based practices. Moreover, learning, critical reasoning, and judgments can be acquired through the training and work experience. Quality improvement. Systematic improvement of care is accomplished through quality improvement. To improve outcomes for patients, healthcare systems, and organizations, quality improvement aims to standardize processes and structure. Throughout the film, diabetes type 1 is portrayed in a positive light, along with its complications. Support systems are also an important part of the story. The end of this film ends with Shelby dying as a result of kidney failure, stroke organ failure.
Okay, good evening. I am here with Dr. Cordelia Padua, and I'm going to be addressing nursing theory by Myra Levine. Generally, Myra Levine's theory is based on conservation of energy, and the goal is centered on safety of the patient. So, Dr. Padua, I have a few questions for you today.
Okay.
You've been in the nursing profession for several years. You are a family nurse practitioner.
Yes.
You've earned your doctorate in nurse practitioner.
Yes.
You practice with psychiatric patients.
Yes.
You also practice with as a family practitioner.
That's correct.
How would you apply safety to your patient? Using self-care, medication error, activity of daily living, self-harm to self and self-harm from others.
Okay. According to the theory of Myra Levine, self-care, Levine states that nursing aims to promote wholeness while realizing that every individual requires a unique activity to achieve wholeness. Levine's theory further stipulated that while wholeness exists when the patient's interaction with the environment ensures integrity, wholeness is promoted using the 4 conservation principles, such as conservation of energy, structure, and personal and social integrity. For medication error, Levine was also an experienced nurse and teacher who sought to educate medical surgical students about significant concepts in nursing. She wanted the focus of nursing to be patient-centered, producing better patient outcomes. For activity of daily living, or ADL, the core of Levine's conservation model is to improve a personal physical and emotional well-being by considering the 4 conservation domains. Nursing role in the conservation domain is to help patients maintain a safe balance, including adequate rest, nutrition, and exercise. For self-harm, the fundamental concept of Levine's theory is conservation. When an individual is in a conservation phase, it means that the person can adapt to the health challenges with the slightest effort. For harm to others, Levine's conservation theory can be expressed in a nurse in a nurse doing her job to the best of her ability, not only for herself, but for the patient in her care, as being the utmost importance.
Okay, thank you so much, Dr. Padua. This is IJ Baduga. You've covered everything I asked for today, and you've been very helpful, okay?
Thank you. I really enjoyed you.
Safety. Speak up for patient safety. No one should be harmed in healthcare. Is this patient demonstrating wholeness? How well is the patient adapting? What is the patient's concern towards recovery? Is the patient optimistic? Challenges, goals, etc.? Promote this by educating patient on resources available in the community that will help with adoption. Is the patient demonstrating conservation? How is this patient's lifestyle, social integration, spirituality, self-image, family dynamics, environment, cultural identity, and everything else that could help identify this patient for health promotion and safety? Promote this by asking open-ended questions about patient's background in past experiences, traumas, goals, and missed opportunities. Is this patient demonstrating adoption? Ensure if the patient is conserving all the 4 principles: energy, physical integrity, personal integrity, and social integrity. We can promote this model by providing the patients with pain medication options, encouraging physical rest, advocating for their needs, helping patients for self-care, daily ADLs, and ensuring safety for them. Nursing informatics. Safety and informatics in nursing areas. Shelby, with a pure circulation system and type 1 diabetes, gets pregnant against medical advice. Shelby has also suffered from pregnancy-induced kidney damage, which required a transplant, which eventually fails and ultimately results in her death. According to the conservation model proposed by Myra Levine, keeping one's personal integrity means recognizing the individual as one who strives for recognition, respect, self-awareness, and autonomy. Likewise, nurse informatics can enable healthcare organizations to reduce medical errors and associated costs. The application of nursing theory to informatics is a critical aspect of healthcare. The nursing profession has integrated the use of information technology in the healthcare delivery. Nurse informatics has been met with resistance from some quarters in the healthcare industry. However, there's no doubt that nursing informatics have enhanced efficiency in healthcare delivery. The introduction of computers in healthcare provision enables relay of information between the admission room and other relevant terminals. The Myra Levine concept of energy conservation should be replaced by applying for orders for energy supplement drugs and nutritious diets from the computer-based order system. These drugs usually act faster than the provision of bed rest to patients. The hospital data can generate appropriate antibiotics to maintain the patient's hygiene and protection from infection. The physician, using their knowledge, can advise the patient on how to protect one's space needs. Nightingale, 2010. Information for patients with several clinical problems are accessible from any room, making work easier. Transformation is the reinvention of how things work or how they can be done. Radiology is one system of transformation that provided computated tomography scan. Nursing is not just an evolving activity, but also a transforming profession. In the treatment of the patient, radiology can be used to scan the left arm and confirm their anatomic status for bone breakage and ligament tear detection. The use of technology is necessary for speedy and efficient services. Applying these theoretical concepts requires accurate interpretation of each empirical knowledge into the clinical practice. Improvement in 2 nursing areas. Levine's conservation model to care for a patient with diabetic foot. Levine's conservation theoretic model is one of comprehensive model theory that can be applied in patients with critical diabetic foot in emergency department. This case study describes the nursing care using Levine's conservation model to care for a patient with diabetic foot. The study was a case study with a single case design. Data was collected using physical assessment, written communications with the patient, interviews, patient's family members, and observing the patient during the intensive care in the ED of Lawan General Hospital, December 21st, 2015. Levine's conservation model used as the nursing guidelines successfully identified patient issues, including ineffective breathing pattern as a major priority of energy conservation problem and damaged tissue integrity as a problem of structural conservation. Both of the conservation problems were caused by patients' personal integrity conservation, maladaptive that caused by ineffective therapeutic regimen management. Levine's conservation model is useful to investigate nursing problem and applicable to solve the emergency condition of damaged tissue integrity in patients' diabetic foot. Levine's conservation model to care for chemotherapy patients. Description of case study. 52 women were recruited from 5 university hospital outpatient departments for this pilot study with an experimental design. Subjects were randomly assigned to the working program or to usual care during adjacent chemotherapy or radiation therapy for breast cancer. Symptoms, physical functioning, and QOL were measured at baseline, mistreatment, and at the end of treatment. The results. Women who exercise at least 90 minutes per week on 3 or more days reported significantly less fatigue and emotional distress, as well as higher functional ability and QOL than women who were less active during treatment. Clinical implications. A home-based walking exercise program is a potentially effective, low-cost and safe intervention to manage fatigue and to improve QOL during adjuvant chemotherapy or radiation therapy for breast cancer. Mark Pickett-Ropter and colleagues in 2001 used the model to study the effect of exercise on fatigue in patients with cancer. Coyne and Rosveg, 2006, studied fatigue and functional status in women with cancer metastasis using the model to assess energy and structural, personal, and social integrity. Hannah Avila Mitaya and colleagues in 2008 found that comprehensive exercise for patients with cancer results in significant improvements in functional status, fatigue, and mood in treatment and recovery. Improvement in 2 nursing areas. Quality. Systematic improvement of care is accomplished through quality improvement. To improve outcome for patients, healthcare systems and organizations, quality improvement aims to standardize processes and structure. Throughout the film, diabetes type 1 is portrayed in a positive light along with its complications. Support systems are also an important part of the story. The end of the film ends with Shelby dying as a result of kidney failure. Myra Levine's conservation model is foundational to whose holistic patient care and care goals. Adequate composites of adaptation to stimuli and an infinite supply of prodigious conservation of health, strength, and balance of oneness to each patient. Holistic care is quite frankly a delicate aspect of one's decision to either initiate a pharmacological regimen or completely foregoing of any pharmacological treatments as a choice within their care participation for desired goals with full informed consent rendered. Competencies to a degree of which adoption is accomplished can vary as evidenced by the intensity, amount, coping mechanism, meaning, knowledge, and experiences to all the stimuli, be it internal or external. Restoration of the body and prohibiting any further physical breakdown is an imperative portion that also carries weight within patient care. This component can be quite taxing and can fluctuate towards convalescent period. Continual and contractual components are required for patient, family, nurse, provider, and other collaborations who can sway the care of the patient to adhere that within managing and improving patient care, these perplexities are inescapable. Nursing education. Nursing education is an active, constant movement that, according to Myra Levine, is an integration of scientific principles. These principles behold indispensable nursing processes, scientific concepts, and objectives that culminate growth and the capacity for renewed improves with each activity in attempt to its documented evidence provided. Supportive data per conservation mode is applicable for nursing undergraduate and graduate level. For this reason, Levine believes that the integrity of this model will forever be and be used as a cornerstone to the profession of nursing and ongoing education to be expounded upon. Nursing research. Levine's model has been successfully used to develop nursing knowledge. Many research questions can be generated from Levine's model. Clinical researchers have used the conservation principles as a framework to guide their research in a lot of clinical situations. Ballard and colleagues used the model to frame their phenomenological study of how participants reconstructed their lives with paraplegia. They found that structural integrity, along with all other integrities, was used as a basis of defining their new lives. Health disparities. Rich versus poor. Health disparities are sustained, worsened health outcomes of a specific disadvantaged group. These health disparities can be health-related quality of life, rates of severity of disease, disability, mortality, injury, or violence. According to Levine, health is socially determined by the ability to function in a reasonably normal manner, and the goal of nursing is to promote wholeness for all people. Nurses can reduce health disparities by advocating for their patients. This may include advocating for patient rights, appropriate resources, interpreters, distress screening, or even cultural competence training in your workplace. In conclusion, the conservation theory by Myra Levine proposed 6 competences to enhance the quality of care of patients. In summary, it is essential to improve the quality of care and limit patient risk by training staff, improving processes, and using best practices, evidence-based practices. The goal of nursing is to promote wholeness. Realizing that every patient requires individual, unique, and separate cluster of activities. Theory extends nursing science by increasing safety, high-quality care, reducing errors. Individual integrity is an abiding concern, and the nurse must take responsibility in assisting the patient to defend and seek realization. And this is a page for our references. Thank you so much.